All right, pharmacy regulation. A lot of things we'll cover. We'll cover R&D process, which will also correlate with the pharma profile for your discussion. So we'll go through research and development, drug regulation, the DEA, scheduled drugs, and how to solve DEA numbers. H-hour. So D-Day 6/6. 6/6 was D-Day. Crazy, crazy, crazy work. All right, so as mentioned, we'll take a look at all those things listed, including OTC and BTC products. So I'll talk about some of these updates from recent years. All right, I'm going to go through the legislation. Don't try to memorize them by the year, by the name, description. Just link the main themes. Right? So Food and Drug Act was the initial attempt to kind of make food safe, and it had to deal with interstate commerce, so from state to state, and pretty much adulteration and misbranded. So misbranded is easy to understand. That's just label. So it has to have correct labels, all the ingredients, and if there's anything dangerous listed on the packaging. And then adulterated. Do you guys know what adulterated means?
Adulterated means that's changed, modified.
Yeah. So it's not what it's supposed to be. You can't trust it. So it's kind of like your marriage. You commit adultery, you tainted your marriage, right? Harrison Tax Act. So before this, you actually were able to buy and sell a lot of what are today controlled substances, like opium, even cannabis products. And there was an increase of opium use, so there was a problem, and they just taxed it. So with that, you need kind of like a prescription. All right. To beef up the 1906 law, they rewrote it, and it pretty much became a new act. The original law was just labeling, but there were a lot of things that were still unsafe. So this beefed it up, and it included cosmetics. So now cosmetics have to be pretty much safe as well. So this required that drugs are safe. There was a drug used in the UK for nausea and vomiting. So when women are in their first trimester, they usually get nausea and vomiting. So what do they give these women? The drug for nausea and vomiting. However, it caused severe birth defects. So we had a whole generation of severely deformed children. So in America, you have to prove it's safe before you can sell it. Durham-Humphrey, OTC versus RX only. So if you see legend, RX only, prescription only, that means the same thing. OTC, do you need a prescription? No, right? No RX required. BTC, have you guys heard of behind the counter?
So now it's BTC?
No, there's both. There's over the counter and behind the counter. So over the counter, you can just walk up to a register and grab it off the shelf, pay for it. If it's behind the counter, like Sudafed we talked about, they have to get your ID. It's behind the counter, so it's more controlled. But do you need a prescription? You still don't, right?
Oh, wow.
So OTC, no prescription. BTC, no prescription. It's just safety measures. But RX only, prescription only, you have to have a prescription. So we separated those two categories. Kiefer Harris. Not only during clinical trials do you need to prove that your drug is safe, but now you're going to have to prove that your drug is effective for its intended use. So whatever you research for during clinical trials, that is the only thing you can put on the label. Right? This drug I researched for blood pressure, I can only put on the label, use this drug for blood pressure. And one of the most important things is still safety. So First effects, the term for that is the generation of monsters. Teratogenic. Right? Teratogenic. Really translate to monster making. So be careful. There are pregnancy categories. A, B, C, and X. Okay? So when a patient's pregnant, make sure you look up the pregnancy category. Category A, is that safe?
Okay.
Yeah, that's okay. All studies show that it's safe to use. B, category B, is it okay? Yeah.
Okay.
We haven't done the studies, but so far, everyone who used it is okay. So if you use it, probably you'll be okay as well. But it hasn't been proven, but it's okay. C, is it okay to use?
Maybe.
Yeah, so we're gonna have to balance the risks and benefits of using it. So it will cause harm. We know it will cause harm. X category?
I'm going no.
No use. So we cannot use it. So double check the pregnancy category. PPP.
And it shows on the label, basically,
It's going to be on what's called the drug monograph.
okay.
So pretty much all the information in the research and development, they write in that piece of paper.
Okay.
You've seen it before, right? The piece of paper they fold up like a little accordion. You open it up and it's all tiny writing. Yeah, that's the package insert. That will tell you the pregnancy, everything you need to know about the drug is in there. The package insert. We'll talk about where to find those. So Poison Prevention Packaging Act, we need a child proof or a safety cap for all drugs. Some are exempt. So some you can put in an easy cap or you can put in a non-safety cap. Patient request it, you can just put it in a pop-off top if there's no children around to get harmed. Or if it's an emergency med like nitroglycerin for heart attack, we don't want them fumbling around with the safety cap if they're having a heart attack.
Definitely don't.
5 schedules, C1 through C5. Right. So we'll talk about the differences in the categories and the DEA. So they are a law enforcement agency and they're upholding the Controlled Substance Act, right? So FDA, they're a law enforcement agency that upholds the Food, Drug, and Cosmetics Act. So they're law enforcement officers. What's the cost of a new drug? What did we say? 10 to 15 years, and it was $2.6 billion, and that is all risk, right? Big risk equals big reward. So, if nobody's sick with this disease, is there a point into looking for a drug? No. So that's an orphan disease because nobody's gonna look and search for a cure for it because there's no incentive. So what the FDA has done is made it easier for you to discover drugs for these diseases that only affect a few tens of thousand people. Make it cheaper, make it faster, so you don't have to spend 15 years and $2.6 quadrillion, billion dollars. Obra, what does budget have to deal with? Budget. Do you budget? What does the budget? What do you look at when you budget? There you go. So this has to do with money. Omnibus Budget Reconciliation Act. There's been many of them, so note the year. This is 1990. So OBRA 90 is what it's commonly abbreviated as. OBRA 90. And there's been other ones, and they specify the year. But if federal patients, so this had to deal with federal patients, who are our federal patients?
Medicare.
Yeah, Medicare are the federal patients. If they take their drugs incorrectly and become harm, where do they end up? Does that cost little dollars or big dollars?
Big dollars.
So this is a budget consideration. For drug use, we must counsel the patient. So this is the first requirement. Tell them, this is what the drug is for. This is how you take it. This is what you look out for. This is how you get a refill, right? We tell them how to take it. Safety, safety, safety. The next one is DURs, Drug Utilization Review. We take a look at your allergies and we cross-reference that. We take a look at your diseases and we cross-reference that. We take a look at your other drugs and check for drug-drug interaction. Because if there's a problem, where will these patients end up? Hospital, costing more and more money, right? Very important, OBRA 90. Anabolic steroids. So for C3 drugs, you can only get 5 refills. So this is the steroids that athletes abuse. So instead of getting a prescription that's good for 1 year, they now, cap the refills. So only 5 refills within 6 months. HIPAA. How do you spell HIPAA? Hippopotamus? No hippopotamus. H-I-P-A. You guys laugh about this now, but when you write a resume and you put hippopotamus on it, right, that goes into the circular file right away. So don't do that. HIPAA. So 2 parts. Continuance of healthcare and PHI. Protected health information. So portability, when you change jobs, you'll have some coverage of health insurance before your new benefits at your new job kicks in. Now, because we know about your health history, I can discriminate against you, so your information needs to be protected. Keep it confidential. All right. Food and Drug Act. Give me the simplest description you can come up with. We talked about it. Marriage. What can you do to your marriage? When you cheat. What's that called?
That's called adultery.
There you go. So this is to protect against adulterated drugs, food, and most importantly, what's on the outside? Labeling. Right. So labeling, packaging, yeah. So adulteration and labeling. How about the Food, Drug, and Cosmetic Act? What did it require companies to do before they can sell their drug? Effective? Not that one. What's before effectiveness? Safe.
Oh, safe.
All right. So you just jumped the gun. You were there. You were there.
Okay.
Durham Humphrey. What categories did they create?
The pregnancy?
The pregnancy ones.
No, the 1 through 5?
No, not 1 through 5. They did OTC versus
DTC.
RX. So prescription versus non-prescription drugs. Prescription is the same as legend. Right? RX is the same as legend. Kiefer-Harris Amendment. What did that require? Not only that your drugs are safe, but now also
Effective.
safe and effective. Right? See how they're building on regulation. Controlled Substance Act. How many schedules? 5. Very good. OBRA. What 2 things did it require? What 2 things did it require so these federal patients are nice and safe?
One was
The drug and drug interactions.
Okay, DURs, Drug Utilization Review, and
That's all I got right now.
patient education on drugs is called
Counseling.
counseling and DURs. And then lastly, HIPAA. What did it define?
Your
What's
coverage,
PHI?
The protected health information.
Yeah, define PHI, protected health information, right? So that's how you want to study them. If you try to memorize the whole exact thing, you're just going to get it mixed up. But if you know the name, know the main points, it'll make it easier. Flashcard items to help you out. All right, new drug approval, help you with your discussion post, which is pharma profile. So pharma are the manufacturers and Researchers of America. So they come out with a review every year, their article. So the FDA will have their own department that reviews new drug application. And it's a few $1 million. I think it's like 3 million now. Not bad. After spending 3 billion, right?
Okay.
About 18 months to review, because it's a lot of paperwork. We got to make sure everything is safe. So make sure you know the order, the sequence of R&D. So the first thing is lab studies. You can mix chemicals together or use computers to run simulations for labs. Preclinicals. So clinicals is humans. So if it's preclinicals, what do we use? Animals. So this is animal studies. So if we find it that, the animals lived, they didn't die, they didn't all die, then you know what? Let's go ahead and try it in humans, right? But before we try it into humans, we got to announce to the world, this is my chemical. And if you take ownership of that chemical, what happens to your patent time? Starts to tick, right? That 17-year patent starts to tick down because the IND is your announcement to the world. Haha, I take dibs. This is my chemical. I found it. 17 years. It's mine. Good or bad, it's mine, right? And then we go into the trials. So we'll talk about the different trials. Phase 1, 2, 3, 4. Are you guys familiar with control groups? So let's say you want to test if a fertilizer works, right? You're going to plant half of your garden with fertilizer and the other half with just plain water, right? And then you compare. Did the fertilizer help? So in that case, what was your control group? Just regular water, right? So you got to compare what regular happens with the new stuff introducing the chemicals. So that's what they mean by control group. So sometimes that might be a placebo. Right? You guys heard of placebo?
Yes.
So it's really just a pill, no really active drug. It's just a psychological thing. So that comes into a blind study, right? A single blind study. Patients do not know what they have. What I do is I have a list, and I put you guys into 2 separate categories. I hand you guys pills, and I hand you guys pills. Do you guys know what you guys got? I got the list. I know what you guys got. Right? So how can that be biased? A single blind study. Who can be biased? The patient or the experimenter? Yeah, the experimenter can be biased, and then the patient can pick up the bias on the experimenter. I'm really happy when I work with you guys. I give you guys the drug. With this guy over here in the corner, I gave him the placebo. I'm really sad when I work with him, right? So they might pick up on that. So to eliminate experimenter bias, we use a double-blind study. So does the patient know what they're getting? Does the experimenter know what the patients are getting? No. Nobody knows. And they just work out the numbers statistically and see if it works or not. So it eliminates bias. Once you get your data, you compile it, and you put in your application. So this is the 3 million 18-month wait where if it's approved, your stock's going to go up. So start selling. Tell all your friends, buy stock. If it gets denied, stock might go down. You tell all your friends, sell short. Right. And then this is phase 4. So very important that you understand that phase 4 is after the drug is approved. We continually see if there's any new problems that might come about that will require us to remove it, or in this case, recall the drug. That means no longer can use that drug. Can't make it, can't sell it anymore. It's way too bad. Right? You guys heard of fen-phen? Phentermine and ephedra? Like 20 years ago, everyone's taking it to lose weight and then they died because of heart attacks. So that's a recall. Can't get it anymore. That's good. You guys haven't heard of it because it's pulled off the market.
Jeez.
But the thing is, supposedly Trump is still or was prescribed one of those ingredients. He was on fentanyl or something. That's why he's so hyper at 90 years old. I don't know, I'm just spreading rumors. Do your own research. That's the entertainment part of your infotainment. All right, so let's go over the new drug approval process. So you guys kind of see where all the hurdles are, all the multiple steps, and kind of the government fingers in almost everything. All right, so we'll do preclinicals. So that's going to be in animals. You can use a rat or a non-rat. You got to use one of each, actually. And what we're doing is seeing how the body reacts. Right? This is what the body does to the drug. So the body's going to absorb the drug into the blood. It's going to move it about the body. And usually in the kidneys, in the liver, that's where the drug is broken down for metabolism. And then in the kidneys is where the byproducts will be filtered out. Okay? So we're just testing to see if it's safe, what the body does to the drug. If it's safe for rats, and for animals, we can go down generations and generations to see if the chemicals affect. In humans, we don't have that much time, and it's unethical to test in an unborn child, right? Don't worry too much about LD50. That's how much drug that will kill half of your patients at once. They use that to extrapolate to humans, okay, so we don't give humans that much and kill them all, right? So all of this is a model for how it might work in a human, and the key term is might work. Once you get the animal studies good, you tell the world, hey, this is my chemical, and you got that 17-year protection. So that 17-year protection is going to run out through your research and development. So first part, clinical trials. So you got your chemical. You're going to test it in healthy people. That's pretty crazy. All right, you just want to see ADME in an unimpaired human. And then you'll make the judgment, is it okay to use in somebody who's sick, whose liver's not that good, or whose kidney's not that good, or whose cardiovascular's not that good? So this is short-term healthy, right? Just extrapolating the animal studies. Phase 2, now it's people with the disease. And we're starting to check for safetyness and effectiveness, right? So everything is safety and effectiveness, safety and effectiveness. Phase 1, phase 2, everything looks good. This is where all your money and time is spent, is in phase 3. Big trials. Have any of you guys volunteered for a drug study? Do you guys know anybody who have volunteered? Right? So it's not a lot of people. So first you got to find them, sign them up, and then you got to follow them all the way through the study. And some studies, 1 year, 2 years, 5 years, some studies 10 years. Right? So that is where a lot of the time and money is spent. Then you enter in your new drug application, up to 18-month review. If it gets denial, your stock prices go down. If it gets approved, usually your stock prices go up. But they can say, hey, you know what? Repeat phase 3. So that means you're going to spend more money and then resubmit your application for further review. So it's still not done yet. So once your drug is approved, so it's very important that you draw a line here. Drug is already approved. Then we go to phase 4. Phase 4 is continued market surveillance to see if we need to recall the drug or adjust the dose. For example, you guys know what Ambien is? Yeah. Sleep aid. So in women, they found that they need to half the dose for women. So after the drug's already approved and a lot of people use it, they say, hey, too much for women, so it should be half. All right, R&D, what's the first step?
Preclinical studies. No.
Preclinical studies, so straight into animals?
No.
Hey, FIFO, Yeah, lab, right?
didn't see that
Doesn't cause any life. Doesn't cost any life. Just little chemicals, maybe computers, and then we go into
Free.
animals, right? Once it's safe in Algernon, what do we do next?
Investigational
Yep, IND. So remember, this is when that 17 years starts ticking away.
Right.
And then you go into
Clinical trials.
which phase?
1,
And then,
2,
and then,
3,
and then,
4,
and then,
and then
and then,
NDA.
and then, remember your drug application. The drug is already approved. Continued market surveillance is phase 4. Right? So 1, 2, 3, application.
Then NDA, then 4.
Yeah, phase 4, aka continued market surveillance.
So, wait. 1, 2, 3. Okay.
All right, you got a little reprieve. If you're slow, you can apply for a 5-year extension through the HatchWaxman Act. So probably they lobbied some lobbyists to write an act, these two guys, and then they wrote an act and they got it passed. Generics. So that 17-year ends. Any company already has pretty much all the information they need to make this drug because it's public, pretty much public information. So it's just copy. They just have to copy, do a little short clinical trial, and then boom, they can start selling the drug. And most of them work pretty much the same. TE, therapeutic equivalence ratings. Very important that you have an A rating. That means brand and generic can be used interchangeably. You find those ratings in the Orange Book. The Orange Book is a chapter within the Drugs Topics Red Book. So the Drugs Topics Red Book give you pricing information on drugs. And just a chapter in it will tell you, hey, can I give the patient generic instead of the brand to save them some money? Where can I look that up? Well, in the book that has the money, right? The cost of drugs, there's a chapter in it. Tells you if you can switch generics or not. A ratings, make sure you get that A rating. When does the 17-year patent protection start to expire for a new drug?
B?
Yep. No, it's not supposed to be there. This is supposed to be moved up here. The animation draw is supposed to be here.
Okay.
Where can therapeutic equivalent ratings for generic drugs be found?
We just talked about the red book. Orange book.
Yeah, if they have both, you're gonna go with the Orange Book. If they don't have the Orange Book there and they have the Red Book, then you'd pick the Red Book. Right?
Okay.
So this would be your first choice. This would be your second choice. OTC, BTC. So these drugs are found to be safe enough now that if the patient follows the directions on the packaging or in the packaging, somewhere on the packaging, that it is safe. So note, they must follow those directions for it to be safe. So if they use the drug another way, not as directed, then it's not going to be safe. But an example would be Claritin. Do you guys know what Claritin is? For allergy. It used to be prescription only. It used to be RX only. Right? Now you can get it over the counter as Loratadine, right? The generic. Or the brand name if you want to pay a little more. So that is one reason they convert to OTC. No problems, no side effects. Pretty safe. Take one a day. It's not very hard during your allergies time. So what else needs to be on it? How much drug name, where it was made, and then most importantly, the directions.
So directions, name, amount.
How to use it.
Yeah, manufacturer. So standard drug info. Why do some physicians write prescriptions for over-the-counter medication? Costs covered by the insurance? Direction for use is incorrect. The OTC product is not FDA approved. There's a drug-drug interaction. None of the above.
Good question.
Not FDA approved. Can you use it?
No.
No. So that one's out. Are directions incorrect?
No.
No. The directions are correct. The doctor just might want different directions, right?
Okay.
Is there a drug-drug interaction?
Could be. Oh, okay.
Right? There's a medical need if it's on a prescription pad, right? Then that justifies payment by the insurance company. If it's not on a prescription pad, it's just you telling them I need it. They're not going to pay for it. Yeah, the bottom line. Which of the following is not required on the label of an OTC product? Do you need the manufacturer
No.
address? Yeah, you need that. Do you need warnings?
Yes.
May cause drowsiness? Do you need the amount of contents? Do you need directions? Yeah. OTCs, you have to have directions. RX only? Do you need directions on the bottle? No, because who gives the directions? The doctor, right? OTC has to be printed on there.
Got it.
Because they're not seeing the doctor. They're just walking up. Oh, this sounds good. I'll do that.
It's a trick question, huh?
So it's none of them.
None of them.
They're all required.
Got it.
All right, BTC. Do you need a prescription?
No.
No prescription. So why is it behind the counter?
To control it more?
Yeah. So mostly it's safety, but also control. So the control aspect is Sudafed. You can make meth from it. So anything containing it. So Claritin. Where can you find Claritin? OTC or BTC?
Is it OTC?
Okay, how about Claritin D?
Go with BTC.
Why?
The D.
The D is decongestant Sudafed.
Okay.
Zyrtec, OTC or BTC?
OTC.
Zyrtec D,
Oh, BTC.
because it now contains Sudafed, right? So that's control just for drug diversion. Everything else is safety, because there might be a reason why you cannot take it, right? Loperamide's prescription only. Wait, loperamide for diarrhea?
Yeah.
Oh, that's over the counter. As long as you follow directions, 1 every 2 hours up to whatever, and that's it, it's safe. Now, if the doctor says, hey, I'm going to write you a prescription, but now you can double up, that's different, right? See, the directions are now under the doctor's supervision. So if you follow OTC, safe. If the doctor tells you otherwise, he's going to take responsibility. So BTC, as long as it's safe through the pharmacy tech or pharmacist, they'll dispense it to you. For example, insulin, if you're diabetic and you run out, do you have time to make an appointment? See your doctor. You'll be dead in an hour, right? So just say, hey, this is my empty vials. Here are my syringes. You want to exchange these used ones? And then they'll write you a prescription, and then they'll dispense you some insulin and insulin syringes. Plan B. All right, Plan B is a big hormone dose, so we want to make sure it's appropriate for the person to use it. And since 2015, it's found to be so safe that it's pretty much OTC now. There's no real restrictions on it. Exempt narcotic is Robitussin AC. That contains codeine.
Yes, it does.
So, in other states, you can get it behind the counter. You just show them your ID, they record it, and then you get a little bottle of it, and it'll stop your cough. In California, since it is a C5, it's prescribed in California. And then Sudafed, we want to make sure you are not making meth. So we document everything.
So, I have a question. The shelf, like, you know how to say these are going to expire in like so many years?
Oh, yeah.
How often does Sudafed expire?
So the expiration date that's on the label is really, really conservative for manufacturers. So the only things that you should be concerned about are antibiotics. Definitely throw those out. Certain other ones will become toxic or they lose potency. But the expiration date on most drugs are stable, well beyond it. But you are taking a gigantic risk. You never know.
Depends on temperature of the room.
Yeah, condition of storage, exposure to moisture, sunlight, yeah. But most things are stable. Which of the following is not a BTC medication? Behind the counter?
We can use that one.
That one's behind the counter. How about insulin?
Yeah.
Yeah, behind the counter. You don't need a prescription. How about codeine?
The AC.
AC.
That's
Yeah.
behind the counter. How about Plan B?
Yeah.
That's behind the counter. So again, none of the above. They were all behind the counter. So that D is trying to get to trick you. Plan B, well, if I put 2015, it's pretty much OTC now. After 2015. So your 11-year-old, I guess, can walk up.
Oh,
Yeah, I don't want to be pregnant anymore.
I didn't know that.
And then I'll post it on my Instagram. Sudafed, what must be recorded? Do you need the patient signature? Yeah. Do they ask for your driver's license?
Yeah.
Do you want to know how many grams of meth you can make?
Yes.
Time and date so they know when you can get more? So it's going to be,
All of them.
yeah, all of them. Sudafed. Yeah. Yeah, Sudafed works very well to decongest your nose, let you breathe again. It's just unfortunate that it's the base, one of the base chemicals to make an even crazier chemical.
Yeah.
NDC, very important. If you want to dispense the correct drug, match the NDC number. So there's 10 digits in an NDC number. The first set of digits tell you who the manufacturer is, right? Who makes it? The second set of digits tell you the drug code or the drug product that's unique for that manufacturer. And the last set of code is the package size. So here you got the NDC number, 10 digits, and it tells you manufacturer, drug code, and the package size unique to that manufacturer. This drug, what schedule is this drug?
Huh?
What schedule is this drug? Is it OTC, BTC, Schedule 1, Schedule 2? How do you know it's C2?
There's a big C there.
Right there.
Yeah, the biggest print ever, right? Big old C2. And it has the warning,
Yeah.
right?
Yeah.
Federal law prohibits, so it's RX only. So are there directions on this thing? If it's federal law prohibits dispensing without a prescription, you won't find directions, right? Because the doctor will give you directions. Storage temperature 15 to 30 degrees Celsius, which is 59 to 86 degrees Fahrenheit. So if they say the word cool, they mean room. If they say the word cold, they mean refrigerator. And a refrigerator is 2 to 8 degrees Celsius. So make sure you know the difference. Cool versus cold. Room temperature versus nice and ice cold. How many digits on an NDC number? 10 digits, very good. What do the first set of digits tell you?
Manufacturer.
How about the second set of digits?
Drug code.
And then lastly,
Size.
package size. Very good. If in doubt, match these 10 digits and the patient will live. What is controlled room temperature?
Something that
Cold or cool?
cold.
Uh-oh. Cool. Room is cool, which is
15 to 30
degrees Celsius, which is 59 to
68.
86.
86. I was just like myself.
If life gives you melons,
Lemons.
no, you might be dyslexic. All right, sample prescription label. So we looked at a sample drug label on a manufacturer's bottle. So this is the label that will go home with the patient. So let's take a look. We got the service provider. In this case, it is the pharmacy that is the service provider. So anybody who moves about PHI will need their own MPI number. Date filled, so not the date the prescription was written, but when the date of service was given. Pharmacist on duty at the time, so we know who checked it. And then usually there'll be technician's initials there as well, so we know who actually processed it. Refills remaining, so we'll talk about the schedules and how many refills you get per controlled substance. Doctor, prescriber, expiration date. So we got the manufacturer's bottle, right? And it has its expiration date. But when we give it to the patient, we repackage it, right? Into its own bottle. So since it's in a different container, the max that we can give it is 1 year, because this is repackaging. This might be good for 3 years in this container, but since we repackage it, the maximum is only a year. So a lot of systems will automatically default 6 months or a year. Your job is to just double check. Make sure that this year and the year you put on this thing is the same, right? Drug info, the inscription, and then we have the signa, which is directions for use. Patient info, RX number. The pharmacy will file prescriptions based on pharmacy RX number. Your scheduled drugs, you have to file them separately. So what's the default expiration date when you repackage?
A year.
1 year,
Up
right?
to a year.
Yeah, up to a year. So it's up to a year, but make sure you always double check that you don't extend
The
any.
manufacturer.
Yeah, don't go beyond the manufacturer's expiration date. If it is, it's easy. Just draw a line and then just write the correct expiration date above it. You don't have to reprint it or anything. All right, controlled substance schedule refill. C1, how many refills can you get? C1, Schedule 1. Give me an example of Schedule 1 drug. Crack cocaine. How many prescriptions for crack can I get?
Zero.
So there is no acceptable medical use.
Correct.
Yeah, we don't dispense crack. Well, they might in the future.
No, let's go.
They said that there's certain symptoms of certain diseases it may or may not help, but we don't know.
Okay, cool. No.
C2, how many refills can you get?
Go with
Give me an example. Percocet.
5.
How many refills can you get? 3 refills for Percocets? Vicodin. How many refills of Vicodin can you get?
2.
Oh, 2. Ooh, you went down a little bit. Morphine. How many refills for morphine can you get?
Just get that in the hospital.
That means they usually don't trust you with it, right?
Yeah.
So, no refill. No, you can't get another morphine. Adderall. Your kid on ADD. You gotta get in every month, get a new prescription. No refills. Because Adderall is amphetamine.
So,
Just add a meth and then you have methamphetamine. It is just a methyl group.
They used to call them like triplicate.
Yeah. We used to use triplicate. So you guys know what triplicate is, right? So it's the carbonless copy. So it used to be the RX kept one, and then the patient, I don't know, one goes to the DEA, one goes on file. But now we just use a secure form. Just like if you have like a check from a bank and you go in the back, there's like a watermark or something. Now that's what we'll use. We don't use the triplicate forms anymore. See, 3, 4, and 5. How many refills can you get? 3? That's it? I'm going with 5 within 6 months.
alright, that's the steroids, right?
Yeah, steroids was 3. So you get your 1 initial plus 5 refills. So you get 1 every month, right? That's why it's 6 months. You get your initial fill
6, so
plus 5 more refills. 1 a month for 6 months. Prescription only? How long are they good for?
a year.
A year, right? And how many refills can you get?
30.
It's usually PRN. Some drugs, as needed. If you run out of your inhaler, asthma inhaler, just go in, get another one, just refill it. Your insurance company may make you see your doctor more than once a year. So even though it's still good for a year, every 6 months you might have to go in just to double check. So that is insurance limitation. All right. So Schedule 1, no acceptable medical use. Heroin, no acceptable use, but we can use morphine and other derivatives of it. PCP,
Okay.
all hallucinogens like LSD, right?
Angel dust?
PCP is angel dust.
I thought so.
Yeah. And then MDMA is ecstasy, Molly. So right now there is some research with that for PTSD and other conditions. So no use in America right now, no acceptable use. So we can't even have a refill. C2, high potential for abuse, addiction, and dependency. Addiction is in your head. I need it. I know it's bad for me, but I just want it. I just need a cigarette. Mr. Dan, can we go break? I need a cigarette. You know it's bad for you, but you do it anyways. Physical is your body now starts to need it. So you can die from some withdrawals from chemicals, like alcohol. If you withdraw abruptly from alcohol, you can die. Cocaine, medical use. We use it for nasal surgery. Amphetamines, as mentioned, that's Adderall, right? Amphetamine salts. And then morphine, just a derivative of heroin. 3, a little bit lower potential for addiction and dependency. So a little bit less dependency, a little bit less addiction. So codeine, so Tylenol with codeine, and then C4, lower potential. So example, like all of your sleep aids, they're usually a 4. 3s are usually your anti-anxiety meds, like Xanax, Valium, things like that. Ativan, yeah. Schedule 5, very limited, low amounts, like Robitussin AC. So low that it is BTC in many states, right? So very little amount of codeine to dry up and suppress your cough reflex. Now technically there is a Schedule 6 that is RX only, right? But usually we don't say anything about RX6. And then Schedule 7, which is OTC, BTC. So we usually only consider the 1 through 5 that you'll get a penalty for. Storage. You must lock up C2s, 3, 4s, and 5s. This is in the pharmacy. So in other facilities, you have to lock them up all the time. But here in the pharmacy, only C2s need to be locked up, and only C2s need a perpetual inventory. That means at any time, you have to know your exact count. 100% accuracy is required. C3, 4, and 5, you can scatter them throughout the pharmacy. You don't have to lock them up. You don't have to be accurate. As long as you're within a, reasonable margin of error, it's acceptable for C3, 4, and 5. Hospital facilities, you still have to be 100% accurate. To order C2 drug, so C3, 4, 5, RX only, behind the counter, you can just put that on your order form for toilet paper and toothpaste if you wanted to. But for C2 drugs, you have to put it on a triplicate form. So here is the old carbonless copy form. So when you fill it out, the pharmacy will keep the third copy. It's only when the vendor gets the 2 copies that they will ship you the drug. So that's what they mean by the paper trail. I need the paper before I can even send the drug to you. So that's how important this 222 form is. And then what they will do is they'll keep the original, and then the DEA will get the hard copy, copy 2. Paper trail, paper trail, paper trail. Which copy of the DEA form 222 is forwarded to the DEA? Yeah, the second copy. No such thing as copy 4. C3 drugs may be kept openly on the pharmacy storage shelves. C3, yes. It's only C2 in the pharmacy that needs to be locked up. That's usually the all right, little calculations. Are you guys ready to now move over to the left side of your brain? A little calculation. All right, so a DEA number contains 2 letters and 7 digits. So if you want to prescribe controlled substances, you have to register with the DEA, saying, hey, this guy knows what he's doing, dispensing controlled substances. We trust him. We checked his background. Your job is to verify that it is legit. So we're just going to go with the standard way of doing DEA numbers. There's other ways of doing it, but this is going to be the simplest. So the first letter, first of the 2 letters, A for male doctors, B for female doctors. We're just going to keep this convention to make it easy. If you're not quite a doctor, but you can still write prescriptions, we're going to call you a mid-level practitioner, and you get the letter M. PA is a physician's assistant. MP is a nurse practitioner. FNP is just a family nurse practitioner. So anybody who's not quite a doctor but can still write prescription, we'll give them the first letter M. Outside the medical field, there are other people that will still need to order chemicals that are controlled for research purposes. So they will get the R for researchers. So they could be a doctor, but you got to note the exact title or degree. So this is a doctor of philosophy, right, in whatever field. Or they might have a master's of science. Right? Second letter, easiest one. Can't mess this one up. Look at the last name. So it's just their last name, first letter of their last name. So the 2 examples at the bottom, we have Dr. Tony J. Smith. What is the first letter?
A for male.
He's a doctor, right? He's an MD. And the last name is?
Smith.
S. The second doctor, Dr. Sarah K. Miller.
R.
R. Why?
PhD.
Yeah. Not a medical doctor, but a different type. And then the last name is M for Miller. RM. So that's the first 2 letters. Get that out of the way. So you only get 1 out of 4 chances here, and then this one you better get right. So you have to identify A, B, M, or R, and then the second letter. Now, the numbers will blow your mind. But are you ready?
Alright, let's go.
Let's do this. Bam. All right, there's going to be 7 digits. You're going to pretend that that 7th digit isn't even there. You're just going to cover it up, and you're not there. You're going to just use the first 6 digits. All right, you're going to take the number in the first position, 3rd position, 5th position. You're going to add that together. So here we got 9.
Why?
It's just the algorithm. That's just the way you verify it. So there, don't ask why, just do. Next, take the number in the 2nd position, 4th position, 6th position, right? Add that together. Not too bad? All right. Now, to this number, the 12, where you had all those even, 2, 4, and 6, you're going to multiply it by 2 to get 24. 9 and 24, you're going to add it together, and it's the number in the 1's digit. That is your 7th digit. Right. So add the number in the 1st, 3rd, 5th position, add the number in the 2nd, 4th, and 6th position, multiply by 2, add the previous sum, and it's the 1's digit.
That's that slow.
So we'll do some practice, and the reason it's kind of crazy is we don't want any geek off the street printing up some prescription pads and getting free narcotics. All right, what's the first letter here?
Oh, wait.
What's the first letter for this Dr. Brandy J. Anderson?
Brandy?
First letter.
A.
A, male or female?
Oh, that's a
Oh,
dude. That's a chick.
That's
That's
a,
B.
yeah, B.
Most likely female. I heard of a Sandy. That's a male.
Yeah.
So most likely that's going to be female.
So
Second letter is
A.
last name. All right. A. All right, now let's do the logarithm. Take the number in the 1st position, add it to the number in the 3rd position, add it to the number in the 5th position. What do you get?
17.
And then we're going to take the number in the 2nd position, add it to the number in the 4th position, and then the 6th. What do you get?
12.
What do we do with this number?
Double times 2.
So you got the 17.
Plus 24.
So what's the ones digit? Or what's in the ones digit?
41. 1.
Yeah, so add those together, 41. So let's see if we got it. All right, very good.
Way out here.
So not too bad, right?
We get work.
All right, so
Help you, yeah.
we'll give Julio choice A. We'll give you, ma'am, choice B, and you'll have choice C. Your job is to verify your corresponding choice A, B, or C.
We don't really have to do this if you don't want to. Okay.
You only got one to do, right?
Alright.
You got A, you got B, you got C. I'll do D. So just verify yours. Is it correct?
Oh, just right there.
No, no. This is the doctor. This is the doctor. You got to make sure that A is correct. Is A correct, B correct, C, or D? Which one is correct?
Mine's wrong.
B is wrong.
Yep.
Mine's wrong.
C is wrong. How about A? Is A right?
A-R so far, and now we gotta do the math.
All right. C is wrong. We know off the bat because
That B.
He's a
male, right? This should have been an A.
A.
So it's
And then we know B is wrong
the
because
last time.
this should be an R, right?
Right.
All right. So is A correct? Did you verify it? No.
So
Uh-oh.
we'll see.
No participation. So just your body can't be here. You got to be here.
So the first letter.
Dun dun dun. So it's either A or D. The answer is both A and D. So A would be correct. D would be correct. Dun dun dun. All right. So let's do the numbers for A. We got 4 plus 1 plus 5 equals 10, and then we got 2 plus 8 plus 7, which equals 17 times 2, which is 34. 34 plus 10 equals 44. The ones digit is 1, so A is correct. And then D, and D is correct as well. So that's DEA numbers. We'll do a lot more in the upcoming
You
assignments.
said D is correct also?
Yeah, both A and D. Digital forms, don't get bogged down with these. If you do something with narcs, you need a license for it. If you make one, if you make narcs, you need a license. If you sell narcs, you need a license. If you use narcs, you treat people with narcs. If you lose narcs, if you lost narcs, if narcs got stolen, you got to put everything on a form.
Narcs.
So that's how important controlled substances are. You really have to have a paper trail for everything. Bureaucracy. All right, home stretch. So for public safety, if you have any side effects or adverse effects that pop up, report them. Anything new to MedWatch, and then they will broadcast that to everybody in healthcare. Now for vaccines, you cannot sue the manufacturers for vaccines. All right, you guys know that? What you do is there's money that's set aside, and you have to plead your case to get money from that pool. But if you have a vaccine problem, then you can also report it. Recalls. We're not talking about defects. We're not talking about Tylenol that smells fishy or tablets that stick together because it got wet or something, right? Like gel capsules. Sometimes they stick together. We're not talking about that, where it's the batch or the lot that's affected. We're talking about drug that is now unsafe, found unsafe, and we got to pull it from the market forever. Right? So class 1, death. Something happens, something wrong. Most likely, it's going to end up in death. Class 2, temporary but reversible. Right? Class 3 is most likely voluntary. It won't cause any adverse reaction. So that is stinky smelling Tylenol. Right? It still works the same. It just, oh man, feet? It's not pleasant, but it'll still work. So that's usually voluntary. Really no likely to cause harm. Which category would the following fall under? Unpleasant odor.
3.
3, right? So most likely not going to cause harm. How about microbial contaminated IV product?
One.
Yeah, that might cause death. What if the label is faded?
Oh, that's probably bad because we don't know what it is.
You're supposed to read it, right?
Yeah, so I'm going 1.
So they're saying, yeah, maybe a 2.
Okay.
So maybe not as bad. How about mislabeled string? That could be dangerous.
1?
Yeah. 1%. Now it's labeled 10% or something. Yeah, that's pretty dangerous. Negligence. So the standard that a pharmacy technician is held is the minimal standard for any technician across the country. So if that minimal standard, that technician would have done it and you didn't, then that's negligence. Right? That's how they determine that. Failing to do something you should have. So this is malpractice. Non-intentional negligence. That's malpractice. So incorrect labeling. Did you guys study your SIG codes? Did you put the same refills, the correct directions, the correct drug strength? HIPAA, right? You can be held negligence. The whole company can be fined. Ooh, that 1 year default. You didn't double check. Now you got drug out there that's already expired. Math, how are you guys with your numbers? Getting better, right?
Yes.
Wrong meds, sound alike, look alike. That's why we have our med lists every week to get familiar with the drug names. Can I trust you with my Vicodin? Can I trust you with my Percocets, morphine? All right. Negligence. Keeping. And lastly, let's go through some terms. Terms are up at the top. An inactive substance given in place of medication. What is that called?
Placebo.
Yeah. So for the blind study, we'll use a placebo. Doing what is required. Doing what's required. Is it a recall, negligence, compliance, injunction? Compliance. Failing to do something you should have done. That is negligence, aka malpractice. The action taken to remove. It's a recall. Specific guidelines. All right, we got 2 more. There you go, protocol.
I didn't know they were up there.
And then lastly,
Injunction.
Court order. Yeah, they're all up here. You don't have to guess. All right, not too bad. You guys ready for week 2, day 2?
I mean, it's gonna happen, so yes.
All right, let's get into it. We can work on it together.